Good morning again. I'm James Hardy. I'm a senior program officer at the Robert Wood Johnson Foundation, and I have the privilege of working on our small and mid-sized city strategy, which is really trying to accelerate the type of learning that we just heard about. I work on housing policy and I work on equitable infrastructure. But what's really cool about today is that prior to joining the foundation, I was deputy mayor for the city of Akron. So I feel very much at home here at NLC and helping to moderate a panel of city leaders. So thank you so much. Real quickly, I just want to talk briefly about the Action Cohort program and the Mayor's Institute program, which are both key components of the Cities of Opportunity initiative. We have on the panel today members of both of these tracks. And I won't go too deep into the Action Cohort because Lourdes just did a fantastic job, but I'm sure she would want me to say, please apply today. But the Mayor's Institute is also a track for obviously mayors and their teams to really identify ways, both data and community driven, to tackle a targeted community condition or need that they see in their city. And so with that, and yes, I'm using notes, so that's just how I keep myself together. We have an incredibly distinguished panel with us today. So first I want to introduce our friends that are joining us virtually. We have Mayor Ron Nirenberg, Mayor of San Antonio, California, and a 2021 Mayor's Institute participant. Texas, it says California on my thing, but you would think I would know geography. I apologize, Mayor Nirenberg. Mayor Lily May of Fremont, California. It's California, right? Yes.
Yes.
She is also a 2021 Action Cohort member. We have on the stage with us City Manager Bob Cowell of Roanoke, Virginia, who was a 2018 Action Cohort Pilot Program member. And sitting immediately to my left, we have Mayor Deanna Holiday Ingram, Mayor of East Point, Georgia, also a 2018 Action Cohort Pilot member. Please join me in welcoming our panel. So at RWJF, we believe that everyone in America deserves a fair and just opportunity at health and well-being. In my area of healthy communities, we focus on the community conditions for health and racial equity, which really to us mean the systems, the policies, the structures that do or do not aid in that effort. And the rubber really meets the road in cities and towns and communities. And so we're really privileged to have with us today such a distinguished panel to talk about all the innovations that are happening at the local level. And so, Mayor Ingram, I'd love to start with you, if I may. Through your work in the Cities of Opportunity effort, you've really prioritized advancing equity, including through a focus on a planning-led effort to align city programs and policies to support greater equity across a number of issues. How has this work changed the conversation in East Point, Georgia? Can you give us some examples of how this focus on equity is creating real change for your city?
Yes, thank you so much, and thank you for the opportunity to be here today. So our journey, as you said, started in 2018 in the great city of East Point, where there's no point like East Point. And what we knew is that we need to do something differently. And we, as a government, were trying to wrap our heads around what does it mean? Like, we know it needs to be different. Equity sounds like something that we really should be striving for, but what does that look like? What does it mean? And how do we let everyone else know that we're shifting? And so we adopted a resolution because it's a council manager form of government, which means my residents think I can change the world, and I know I can. And we, so what was key for me is making sure that there was commitment from council to equity. And so through our participation in the pilot, we adopted a resolution that indicated our commitment to equity, formed the Equity Ad Hoc Committee, and then soon realized that we needed partners to do the work because, again, we had the will, but not the knowledge and not the know-how. And so we engaged Partnership for Southern Equity to help us draft the first of its kind equitable growth and inclusion strategic plan. And in that plan, we grounded it in commitment to community engagement, just industry. And so really briefly, I say this often, but in July 15th, 1912, East Point City Council unanimously adopted an ordinance that required all Black people to live immediately adjacent to 3 fertilizer plants, an oil plant, and a chemical plant. It smelled so bad, they called it Stink Town. And they were for, very self-serving reasons, so they'd be closer to work, so they could, not get missing or, be on time, but really environmentally toxic conditions. And so as we were doing this work, and I learned that, and I realized it's not just about a feeling, it is a requirement, right? It is not that you do know better, you do better. And how do we do that to right those wrongs? And so just industry is looking at how do we have adaptive reuse of vacant industrial properties, as well as with our new zoning districts in an industrial, we put a moratorium in place for almost a year to change some of those requirements, push those types of uses further back if they're new, and to say this is our commitment. We also have inclusionary housing. It's important that we ensure that we have housing that everyone can afford regardless of income level, and making commitments and working on ordinances for that, and then equitable economic development for community benefits, and making sure we have a community benefits ordinance in place. And so how did all of that help, and what change took place? As a part of the planning, of course, while we're building our knowledge, needed to make sure residents' knowledge was being built as well. And so we had a East Point Equity Leaders Academy, and we had residents, 5 from each of our wards, Ward A, B, C, and D, participate to start creating more knowledge in the city around it and how to do the work. And then now we have them a part of work that we're doing through our city agricultural plan, and through our work with Morehouse School of Medicine, which I'll talk on next. And so the planning that we led, and the infrastructure, and the changes that we made, position us to be able to be the community of focus for up to $1.1 million grant that the Morehouse School of Medicine received to focus on advancing health equity in East Point. And so those types of changes, and looking at how we change our ordinances, is really creating the infrastructure, the planning, and the message, right? That we're committed to making sure equity and inclusion is more than a cliche.
Powerful. Thank you for sharing that. Want to go to you, Mayor May, in our virtual world for the next question. In this Cities of Opportunity effort, with your leadership, you have built a multi-sectoral partnership to ensure an equitable approach to behavioral health for all residents of Fremont. From when you started this effort to now, what has changed in your city's approach to better meeting the behavioral health needs of the vulnerable residents of Fremont?
Sure. So good morning. It's a little bit early here. So I would say Fremont is the 4th largest city in the Bay Area and has about 230,000 residents. And we're also just noted as the 4th greenest city. And sometimes I jokingly say, not only are the cars supercharged, so are the people, which helps in this morning. But when we viewed some of the challenges that we're facing from a national perspective, we have some unique, when we talk about equity and racial population, some unique perspectives. About 2/3 of our residents are Asian or Asian American, and we're actually the 6th largest Asian city in the United States by population. And almost half of our residents were born outside the United States, and about 2/3 speak a language other than English at home. So sometimes delivering this type of access is very important. With these types of demographics in mind, we were trying to shape the approach on how we take addressing health concerns in our community. And before this effort, our city had implemented a new health record system in our Human Services Department, which provides social services such as mental health support to many of our most vulnerable residents. And through the Cities of Opportunity Action Cohort, we built on this capacity. And one of the areas is working with a partnership with Washington Hospital, one of our largest healthcare providers, and developing a data sharing agreement. It allowed us to share data in 2 directions. First, on residents who are frequently accessing the hospital for emergency mental health services, and secondly, on residents using our city mental health services. This effort is challenging as the data is confidential and requires sophisticated data sharing agreements. And in addition to technical challenges, having different databases, having our teams work together as well. We also added the data, which is very important, from our police department mobile evaluation team, which responds to the 5150 calls for mental health crisis situations with both a clinician and an officer working in tandem. And our partnership then also expanded to include our county emergency services department to coordinate data regularly collected on individuals that are high utilizers of ambulance and emergency room services. Having this data sharing in place now gives us the city and the hospital an opportunity to begin to map those in our community who are the most frequent users of emergency mental health services, so that we can better coordinate warm hands off and also follow up with services, particularly after release from the hospital with our vulnerable populations, like the homeless or elderly, as well as our youth now that we're seeing across the nation on mental health. With vulnerable populations like this, we want to have after emergency hospital visits and help provide support, access to medication and follow-up, which is critical to help people remain stabilized and have better health, long-term health outcomes. We want to begin to cut down on our revolving door of repeat service users while providing better health outcomes for them. Fewer repeat transports and visits to the emergency hospital room can also reduce taxpayer costs over time. Lastly, we also worked with a graduate student from UC Berkeley, their Goldman School of Public Policy, to help us map assets in our region from systems level perspective. They helped us identify gaps in behavioral services throughout our area, and this can allow our local consortium of healthcare providers to dialogue with our county healthcare agency for the allocation of more resources. So all these efforts use behavioral health systems and services to target different elements of our overall approach and systems level goals to addressing equitable access to appropriate and coordinated health, housing, and social services that will hopefully promote better positive outcomes. So thank you for asking me.
That's wonderful. Thank you for sharing. Next, Mayor Nurnberg, I'd love to go to you, Mayor of San Antonio, Texas, not California. With your leadership in San Antonio,
you're teeing up a joke about migration in our state, but I'll leave it. I'll leave you to it. So
I mean, I was trying to put it out there for you. You can tee off on it if you'd like, but it's totally your call, Mayor. With your leadership in San Antonio, you've brought a comprehensive workforce initiative forward, and you brought that also to the Mayor's Institute as part of the Cities of Opportunity initiative. And you're really focused on job creation and economic opportunity for all. So the question is really, as you reflect on the progress that you have made and the road ahead, what strikes you as critical to your success so far, and what is going to be critical for success going forward on your initiative?
Well, thank you very much, and honored to be on the panel with my distinguished mayors, colleagues, and compatriots in what has been a very challenging few years. So thank you. A little bit of context, very similar to what Mayor Ingram was saying. We have all, in every city in the country, I think, been dealing with the consequences, the legacy of redlining. And so, in examining what we promise our communities when we run for office, and knowing that the solutions are often being delivered in a political sphere and in local governments, what we all promise is that it shouldn't matter what part of town you live on, what district in our city you live in, you should have an opportunity to thrive. And so in 2017, we began the process of taking on the entire city budget through a city budget equity tool to really, instead of dividing everything up in 10 different pieces for 10 different districts, apportioning the resources where they're needed the most. And of course, in different areas of town, through a legacy of redlining, we have had vast disparities in terms of the quality of infrastructure, the availability of services, et cetera. Those show up in outcomes related to public health. They show up dramatically in economic mobility and income level of households, et cetera. So over time, we've developed an equity atlas tool that really looks with data into census tracts and how different census tracts are performing on health outcomes, et cetera. And we have found some pretty stark differences across town. I bring all that up because everything that we've been doing, and this is something I ran on as mayor, everything that we've been doing, whether it's from investing in streets and sidewalks to our affordable housing plan to now what is a workforce development initiative, the largest of its kind in the country's history, has been based on achieving equity in our communities. And so during the course of the pandemic, in fact, right when the pandemic hit, economic mobility struck us all in the face. Those who had less economic mobility, those who had or more disadvantaged, less access to education were the hardest hit during the pandemic. And we noticed that, or we saw that in plain view at things like, at places like our food bank lines, which had the lines double literally overnight, populated by families who were one event away from economic catastrophe by losing a paycheck or losing a job. So we went all in on addressing that challenge. And so during the pandemic, we, noting that we had 150,000 people, families apply for unemployment benefits during the first few weeks of the pandemic, the vast majority of them earning incomes less than $22,000 a year, we began to design a program that would, number one, provide some assistance to get through this period of time where really their jobs were totally lost, but also give them a path to skills training and education for a job that will be there when the pandemic clears and hopefully for the future. Because we also found that a lot of those jobs that were lost might not ever come back. Some would take years to come back, and the disproportionate number of those jobs were coming from service industries. So we established a $65 million program targeting individuals who had, again, been disrupted from income because of lost jobs during the pandemic. And what we found was, in using equity as the tool for us to approach the outreach for this program, 70%, and I can provide some numbers. We had over 17,000 people in our community express interest in the program. We had thousands of folks sign up for program. The program is still phasing out because we're going into a new one I'll describe in just a second. But 70% of program participants were women of color living at or below the poverty line. So essentially what we are trying to do is ensure that as we emerge from this pandemic, we have a more resilient community that has access to education and access to education and skills training so that they can have economic mobility for the future. That will impact positively themselves, their families, but also generations to come. In the height of the pandemic, knowing that we were on the right track, utilizing data to make sure that we're moving in the right direction, we launched, or we put on the ballot, a sales tax initiative to launch a phase 2 of this program called Ready to Work, which just has launched. And it's roughly $230 million to reach, we hope, roughly 40,000 people in our community over the next 5 years with new skills training and education so that they can have take the jobs of the future, jobs with a future that will provide economic mobility for themselves and the family. And let me just add one point before I close. It's not just about the training, it's connecting them with employers who want participants, but it's also ensuring that we're putting effort into eliminating obstacles for people to complete that training. Oftentimes someone who is in a training program or in a school for acquiring a certificate or a degree, what keeps them from obtaining that degree is something as simple as childcare or transportation or a housing payment. We are surrounding this program with a constellation of social services agencies. The bulk of the funding is going towards eliminating obstacles for the participants and making sure that they have career navigators help them through the course of their training program into a job and ultimately find stability within the first year of that job.
Wow, bravo. Thank you for sharing that, Mayor. Bob, I wanted to go to you next. You are an OG member of the Cities of Opportunity. You go back, as Mayor Ingram does, to the very beginning, and you stayed involved. Can you tell us about where Roanoke was in addressing equity in 2018 when this journey started for you? how equity now grounds the city's key functions. And as an example, maybe get in and share with us how equity is grounded in their planning, resident engagement, and budgeting processes.
Sure. Thank you. And first, let me say what an honor it is actually to be on a panel with mayors. That's it's nice to be the non-mayor in the group. So thank you for that. Thank you for that opportunity. Yeah, exactly. Yeah, I don't have to run for my positions. Most definitely. So Roanoke is a small 100,000 person city that is located in obviously southwestern central Virginia area. It's set in a beautiful setting. We have a lot of really positive economic activities going on at this point, but we have a legacy also of folks that aren't participating in that success, and those are in part because of racist practices and in part because of disinvestment out of manufacturing. So it's kind of this interesting sort of dichotomy of what's causing those pieces. And I think inside that context, we had been doing prior to our work with Cities of Opportunity what most cities would be doing in that regard, in the sense of our professional development and training. We're focused on DEI and those kinds of things, and we were making good progress, I think, in learning and understanding. But we really were not seeing a whole lot of action around those activities. And then the world changed, and the world changed in part because of a renewed emphasis on action from my elected officials, that they wanted to see more of that. But then, of course, you had COVID come along as well. You had the George Floyd murder. You had a whole host of other activities that really spurred us into focusing more on action. And that's what we have been focused on really since that time. And I'm just going to sort of run through a list here of some of those things that we've moved from that discussion into action. And it was interesting to hear some of the comments earlier about the emphasis on systems. And so we've tried to build the foundation that's allowing us then to move our systems into place so that this becomes permanent and transcends election cycles, administrations, and those types of activities. So we started with the policies. So our comprehensive plan happened to be being updated at the same time we were going through Cities of Opportunity. And so embedded in our comprehensive plan now are overarching themes of health and all, as well as interwoven equity. So right at the beginning, all of our policies, whether they deal with transportation, housing, economic development, are all grounded in that aspect. Council revised its strategic plan, changing its vision and mission to be explicit about its desires to advance on racial equity and on other items that we've discussed. And then we, in turn, in the organization, changed our own values as well as our strategies to match that as well. So that was kind of the grounding in those policy documents and policy statements that let us move forward. Then the action started. So the first thing the council did is they actually appointed a council-appointed body that's actually led by our vice mayor. That's the Equity and Empowerment Advisory Board. And they are a group of citizens who comb through all of the city's policies, practices, and standards, looking for disparities, looking for areas where we continue to promote inequitable practices and make recommendations for changes in those as well. Inside the organization, we have established every single department now has equity action plans that are explicit actions that are designed to actually advance on those objectives as well. All of our CARES and ARPA money has all been funneled through this approach. So we empowered our residents to actually gather and suggest to us what it is that we should be spending those dollars on, and they're all oriented toward addressing disparities that exist within our community. We have implemented a language access services program so that regardless of what language you feel comfortable speaking in, the moment you arrive or engage with a city service, you have access to a live person that can speak in the language that you feel comfortable with. So that was one way we dealt with that as well. We have also kind of riffed off of the Cities of Opportunity and have started a program called the Neighborhoods of Opportunity. This is where we have taken $1 million of our ARPA funds and we're establishing resident leader councils and saying, you tell us how best to spend these dollars to address the health outcomes that we're trying to move on in your neighborhoods, in your community. And probably the biggest undertaking that we have underway is very similar to the mayor in San Antonio was talking, which is we're completely changing our budgeting process. So our budgeting process has always been focused on outcomes. Now it's focused on equitable and empowering outcomes. And we're going through every single program that we use in our city and determining, can it be tweaked to adjust or tweaked to address a disparity or to empower residents that have otherwise not been empowered with time as well. Last thing I'll say is with all of that, we're still very much at the beginning of all of this work, but we feel like now we actually have the structure in place to actually move beyond the very meaningful and worthwhile words that we were using prior and learning about into real meaningful action.
Impressive, everybody. Thank you. I want to. I have a follow-up question for each of you, and we'll go in the same order. So, Mayor Holiday Ingram, we'll start with you. But the two themes that are starting to pop up for me, just listening to all of you present, are intentionality around equity. It's not an accident that you're making progress on these things, and the real importance of committed leadership. So, for those of us in the room and the many on Zoom land, one of the things that's coming up for me are, how do you lead that change? What are the lessons that you have learned, each of you, as you've moved your way steadily through this intentional change, moving beyond the traditional paradigm of economic development and broadening this view of development as inclusive of health and well-being? What lessons have you learned along that journey that you might be able to share with all those listening?
Yeah, I think the lesson is one of the main lessons is the importance of culturally informed community engagement and having real community engagement along the way, and making sure that as you're doing the work, the people in your community understand what it is. So equity sounds, I mean, we're in this space, and so we know what it means, but what does it mean for a resident? And allowing them to share in their own way what they need, what are they feeling about the issues that are happening, and creating opportunities for them to be a part of the process and lead. And so we had a community health needs assessment survey that we, even canvassed to help get people to complete, and popped up at different like sporting events through our Parks and Recreation program, and incentivize people to tell us or complete this survey. And it covered a number of different things, so that we could have real authentic community voice that allows us not to speculate, but to have something more relevant. And I think that's critically important for making sure that you come up with the right solutions or real solutions, to address the real issues and really transform the community. But it's also important because you want to make sure that you give residents an opportunity to lead and be a part. And in the world of politics, things can get bogged down in policy and political whatever. I like to think sometimes I'm not that in that space, but I am. But the reality of it is that the people can demand power and demand change, right? Power is sustainable and able if the people understand and demand it. And so that's a key thing, especially for this work, because this work is so people focused. And I think a lot of times people feel like they may be left out of government. And this is a space where they really can engage, and we really can empower, equip, and educate them to really be transformative. And the level of intentionality, looks like you end up having residents speaking up more and not being afraid or feeling like it's hopeless. Right? We have a developer who's trying to put a substation directly across the street from residential housing, and having created an environment and even changed our industrial ordinances. Now that's not allowed, but it also gives residents a sense of being able to fight for the benefits for their community and stand up for what they need.
Thank you for sharing that. Mayor May?
Sure.
Any
So
lessons learned?
Sure. So I appreciate all of my fellow mayors for their input. And I think I was talking about earlier how data sharing can be a very challenge, and especially in a community where we have so many people speaking so many different languages, having language access is really important. And whether it's things like when we did our redistricting, having that available in 8 languages, because we have over 95 languages, but if you count dialects and other things, over 105 languages and dialects being spoken. And it's very important for us to be able to coordinate and work with our ethnic and faith-based groups. It's also important, I have to note in this moment, of some of the xenophobia and Asian challenges or in terms of in our community, to make sure that we stand to make it safe and encourage people to participate in these process. Even and especially on this area of mental health, there has been a lot of stigma in the past of having a model minority. And so having to put aside some of those stigmas and preconceived notions about individuals in our communities, and recognizing that every group needs these support services. And when we partner with our hospital and county emergency health systems, to look at the mobile mental health evaluation, for example, or how many our older clients are in that space, And then in particular, also one of the challenges during these pandemic times is, as much as I love to see you all in the Brady Bunch box, to be able to get a chance to see people in person. And it's really impacted also a lot of our youth who have a lot of pressures, whether it's for academic success or from cultural expectations and other things in terms of performance. And I know that even for myself, as leaders in our community, there is a lot of this fear and apprehension right now. So public safety and how we work on those to coordinate with reducing the number of clients that are revolving in and out, taking the time to understand these types of goals and help to increase the coordination. So like I said, data sharing and partnerships, but also including our ethnic and faith-based and making sure language access so that we can include everyone's voice. And a lot of times, like I said, in being one of the largest Asian cities, people have this idea that everyone's doing well. It's the Crazy Rich Asian movie or something. And it's not the case. There are many, many needs within this diaspora, mental health and social services that are also needed. So thank you.
Thank you. Mayor Nuremberg?
Yeah, I feel like I should just say ditto to what Mayor May and Mayor Ingram said, but let me add a little bit of to what we've experienced here in San Antonio. Language access, access to information is critically important, and so ensuring that you're meeting people where they are, which means that in many cases the most disadvantaged members of our community aren't getting the information that you think is basic. So what we've had to do is rely on community health workers to really establish a connection point on just about every city service, public service that's available, actually going to people, knocking on their doors, et cetera. Also because there's a lot of trust to be built back in those communities. Believe very strongly that equity begins with having a voice. And so ensuring that we're doing everything we can to provide that voice, provide a space for people to speak out is really important. Now, the other challenge is something that Mayor Ingram said as well, which is that this is all being done in a political space. Equity and the lack of equity can't be bridged overnight. It's not going to happen within a single budget. It's not going to happen, frankly, within our times in office. And so maintaining a level of commitment on the part of political leadership is absolutely vital. Conditioning our community to have uncomfortable conversations about addressing these challenges is critically important. Our greatest concern is that, it takes a level of sobriety in the equity conversation to be able to continue it over the course of time that it's required to address it, which is a very long time. And so, we want to make sure that people are educated about what redlining means. And while it may not be their fault, they may benefit, disproportionately from some aspects of life. It's incumbent upon all of us to address those things together. Having been through a pandemic is no better illustration of why. For instance, if we didn't get out into the neighborhoods that frankly are some of the lowest socioeconomic zip codes in our community, if we didn't put extra effort to make sure that they had access to vaccinations, to information about how to protect their families, et cetera, people in our entire community would feel the effects of that. So that's a great view into why it's important for us to think as a family, as a whole community, and ensure that everyone is able to thrive. And that's going to require allocating additional time, resources, and effort into areas that have been left behind for far too long.
Thank you. Bob, lessons learned?
Sure. So as the manager in the council manager form of government, my task is to take these ideas and really move them along, move them into action. And I really appreciate the conversation about sort of transcending those cycles, whether they be political or election or what have you. So my lessons tend to be oriented around that. One of those is, I would say, definitely maintain an emphasis toward kind of adaptability, but with a rigorous focus on the objectives that you've set out to do. We've changed a lot in what we're doing since 2008 when we got started, but we've never wavered in that this objective is to help people live longer in our communities and to address every aspect that is a barrier to that success, whatever it takes to make that happen, but never lose sight of that objective. The other is to focus on things that really are not easy to change as administrations change and as elected officials change. So focus on things like systems, in your internal policies, your budgets, those types of things as well would be a second lesson learned. And then I'd say, the third for us has been really critical to establish and nurture the relationships with your anchor institutions. You've heard references here about hospitals as well as universities and others. And in many instances, it's because they're some of your largest employers, if not your largest employers in the community. They often own a lot of real estate, and in many cases are often right adjacent to some of the neighborhoods we're talking about, some of the zip codes we're talking about. So making certain they're a part of it is essential. And we were fortunate in our case in that pilot project we did all the way back in 2018 included the vice president of our health system, and she's been with us through this entire process. So those are my lessons that I've learned kind of through this process for the organization.
That's really helpful. And actually, we've got time for one more round of questions, and that's kind of building off of what you just said, Bob, and what our friends at the Urban Institute shared with us this morning in terms of the importance of cross-sectoral partners in this work. What has been the role, Mayor Ingram, of partners outside City Hall in advancing this work?
So the role of partners outside of City Hall has been huge in helping to advance the work, because it takes the work outside of kind of the political space and conversation to a more community, more partner-oriented type conversation. And so having Morehouse School of Medicine, Partnership for Southern Equity, convening, with our local hospital that unfortunately is no longer providing ER services and hospital services, and is one of 6 hospitals that have closed or one more will be closing November 1st in the last 4 years in our state. That's a whole nother conversation, but it's important because we have those relationships. And in order for this work to sustain administrations and, the constant change within government, it's important that there's a huge focus on bringing partners, community, residents, and others to the table to continue to help this work grow and also inform it, right, from the lens of what's needed, what's relevant, what are the real issues, and who should really be at the table, and continue to build those partnerships and that coalition to help sustain the work.
Mayor May, role of partners?
Sure. So knowing your specific community is very important. In addition to redlining in our city's history, we've also had to deal with having a large Asian population, Japanese internment, and we also had the even HOA laws and sometimes in our cities that have been a challenge. So working with our local organizations to make sure those are changed. And then also an area when we talk about equity that may not have been really touched upon earlier as much is we're also proud to be home to both the California School for the Deaf and the School for the Blind, and working with partnerships to ensure that all are able to have access to our resources. And in particular, also with the special needs community, when we were talking about mental health and supportive services for the family, because of a tragedy we faced before with the loss of an individual and her son, we just recently held our first ever disability public safety access resource fair to ensure that they were given the opportunity to be included in this and to have a positive outcome from these challenges. And so doing things like that and launching new online community engagement platform, My Fremont, and then bringing back some of that in-person contact. We used to have a lot of our coffee with the cops and boba with the cops, cannoli with the cops. As you can see, we love our food and our fuel. But that's truly a way to get people to come together. We find out there's so much more in common than we have differences, and to focus on this as a positive way. I mean, for us, the biggest part of community is the word unity and how we can bring solutions. And in this moment, when you're faced with so many viruses, and the virus of hate is one of the biggest ones that we have to tackle. And so we want people to be more united, to work on translation services, to work on more accessibility. And I'm just delighted to hear from my fellow panelists and for all of you who are participating. I encourage other cities to join in the cities of opportunities, because I have to say that this is one of the best ways to help empower us to share the better practices. I'm not ashamed to rinse, reuse, and repeat, and to be able to amplify and to advocate for greater resources and in partnership with my fellow mayors. And it's nice to see you. Thank you, Mayor, for for all your support in the past, and we've been to your cities, and this is what we need to have is right now in this moment when there's so much challenges, we do so much better and are so much stronger when we're united together. So thank you for this opportunity.
Thank you, Mayor Nuremberg.
Yeah, 100% agree with what Mayor May just said. Also, you know, let's be honest, there has been an erosion of trust in government institutions, and unfortunately, local government is not immune to that. So we have found great success, not only in, you know, establishing partnership and sometimes even working on public-private partnerships, but also in terms of finding communities of trust to, you know, provide education about what an affordable housing plan means or why affordable housing is important for our entire community. Our Ready to Work employer engagement team is devoted to establishing connection between the training program I described and the employers who are doing the hiring of people in our community. So creating those connection points helps to deliver a message that should be, you know, maybe 60, 70 years ago, pretty well received universally, but unfortunately through the political lens has suffered the same fate as so many others. So it is about trust. It's about establishing where or finding where people congregate together and establish those communities of trust that we can make these efforts to improve our community more successful, I believe.
Bob?
Sure. And what I would say tied with partners, I think one of the things that has helped us as well is to be consistent with the messaging, and it helps them so they don't hear different kinds of messaging. At the same time, I think also creating a sense of urgency and action and orientation toward action. This is not something that we can just kind of file away with 100 other things to do, that it really is very important work that really demands action, and it helps move partners, I think, when they see that. And then the last thing I'd say around this is to remember, particularly in this effort, when we're talking about cities of opportunity, is to remember that opportunity part. You know, this is really about unleashing people's potential and really advancing on strengths. And yes, we're trying to solve, in some cases, centuries-old problems and overcoming challenges and issues, but we really, I think, need to keep it very much focused on the positive, and that by doing this, you know, we unleash the ability for folks to fully participate in our communities, for them to be able to be successful, whether it's economically or in their health or what have you, and all of our communities and all of those anchor institutions will be stronger for it. And if that's not a compelling message to, you know, go ahead and get them involved and acted upon, probably need to find some more partners in that case. So.
I think we have time for one or two audience questions. Oh, yeah. Anyone with a question? Oh.
Can you hear me? Yes.
Yes.
So we have a lot of questions in the chat from our audience online. One good question here is from Kitty Dana, who used to work for NLC. And she's asking, could our panel provide examples of building trust with the community beyond their having a voice to actual concrete opportunities in making decisions that benefit their community or neighborhood? It can be very small, but concrete and visible. I believe Roanoke has examples of this.
Wow.
Thanks, Kitty.
There you go, Bob.
Well, of course, it's awesome to hear from Kitty, who got us into this as well. So, and I'll be very brief with this. So probably the best example we have is we have had for a number of years a process by which we commit more than at least 50%, 51% of our community development resources, so the funding that we receive from HUD through CDBG, Home, ESG, and so on, into what we refer to as a targeted community area, which is always oriented toward trying to address some kind of disparities in those areas. And we do for 5 years. So we make a significant investment in that area. Historically, staff chose, based off of data and some other things, that we partnered actually with Change Labs and a couple of other folks to assist us in this effort, where we actually brought in residents from throughout our city, including those that had previously been in some of those communities, to identify what that next community should be by choice. And the story we like to say is one group of folks came in absolutely intent on advocating for their neighborhood, that they were going to be the next target area, went through this process of empowerment, and at the end of it, they actually advocated for the other neighborhood because he said, based on what we've heard and based on the engagement we've had, that's where the investment needs to take place. And that's the neighborhood we're working in right now. So.
Wow. Next question.
Yes.
Right.
There's a question here from Alfredo Vergara, who's from Portland, Maine. Can someone please speak to funding? Many of these great ideas require building capacity and systems. What are some tips on funding that?
I'd like to take that one.
I would say definitely do the work and be prepared to be able to make the case for funding. Again, I gave the example of Morehouse School of Medicine and the up to $1.1 million. We just received confirmation that we'll get the $375 for the second year, so that's a guaranteed $750,000. Also, we used ARPA funding. So in this historic time in our country, and because of the work of NLC's federal advocacy and our state leagues, cities across this country received direct funding, so we were able to use some of that. And then as we look for sustainability, right, because we, during the pandemic, positioned ourselves to receive grants that we hadn't usually received. So to support people experiencing homelessness, we received about $150,000 from the county, and the county had never opened it up to cities. It was just something that the county had done, and we were one of 14 cities in the county, the only one to actually apply for it. But now we're positioned to be able to continue the work. We also applied for mortgage assistance through CDBG from the county, and that gave us a 10%. So it was $500,000. We received 10%, $50,000 for administrative support. So that started helping us build internal infrastructure, and then it helps make the case to allocate general fund dollars to the work as well, and to continue to leverage that to attract other funders, funding from others, because now we'll have outcomes, we'll have some, data and some evidence of doing the work.
All right, I think we got time for one more question.
Right. This is.
Oh, Mayor Nuremberg, do you want to jump in on that?
No, I just wanted to add to that a couple things. One is alignment with other entities. So we've really aligned our priorities with our county, for instance. So getting together to make sure that you're maximizing the community resources that are available, which are not always residing in the city. That goes for private sector as well. Obviously, we have an enormous opportunity here with the intervention, the partnership that we're seeing with the Biden-Harris administration, the federal government intervention. But that's also speaking to the fact that equity is a foundation. We're trying to build resilience in our cities. Equity is a foundation, so it's a framework for any funding that goes forward. And so I did just see someone had a question about the sales tax. We reevaluate our priorities during this period of time. It wasn't actually a sales tax increase. We shifted priorities from where that sales tax was going before, found ways that we could accomplish the work that was doing previous to the sales tax for Ready to Work. We found ways that we could do that work differently, but it does require a reevaluation of where you're putting your effort and resources to begin with. So the resources might already be there to establish an equity framework. You just have to reevaluate what you're doing right now.
Go ahead, Mayor May.
Sorry, I just wanted to jump in on, and it might not be the most common one that you think about, but I want to share, just ask also, because we have one of the largest Afghan communities. And when we were facing some of the challenges and being a city where so many people have immigrant experiences, we set up an Afghan refugee help fund and wrote to the community and asked for help and reached out. And we were able to collect and raise over $474,000 this last year, which we delivered not just to our city, but also to neighboring cities around us because of the diaspora and because of the affordability and cost of living. So we were very honored to have the community in over 40 states, and a lot of it locally, because we had a large influx originally from Afghanistan many years ago. And so those who've experienced that, and then within the Vietnamese community, within so many other immigrant communities who've experienced and wanted to make sure that they could help others in that moment. And so, we truly are blessed. And so looking at just your local resources, looking with local nonprofits, and then working with other programs that are available, for us, one of our things right now, you're seeing the great resignation or changes in the workforce. So working with companies where they know one of the biggest struggles is finding people. So it's not just bringing people here, but then upskilling people and working with our community colleges and those programs to make that happen, and then to reimagine and rebuild that future.
Well, it saddens me to bring such an inspiring panel to an end, but we are at time. Please join me in thanking our city leaders.